Yes, from a consumer point of view, clearly not enough lessons have been learned. I think we need to be really clear in this regard, though, that we and who we're pinning what on. Consumers expect that providers will have made available use of what's been made available to them, which, for example, are very clear guidelines as to what you do now if you have a COVID outbreak. Very, very clear guidelines, including what you do in the first half an hour, what you do in the first 24 hours. So we would certainly want to see consumers. I think there's an open question now as to whether, in fact, the Commonwealth, which funds and regulates aged care but doesn't run aged care, providers run aged care, whether the Commonwealth's regulator, and I was quoted yesterday by Councillor Assisting, needs more powers. We've been of the view that the regulator needs more powers. If it has more powers, it'll need more resources as well going forward. Traditionally, providers have complained about that. Well, I think maybe we've reached a situation where that needs to be reviewed. Can I also make the point, Karen, that there are many providers, including right now in Victoria, who have outbreaks of COVID, who are managing it well, who are exemplary, who are a benchmark for their industry. There are others who have not done it properly, and you have heard me say many times, there is too much variation of quality in this industry. We need to be able to get the bad ones out, and we need to be enable the good ones to expand and grow into that space. We have to do that urgently.
Yeah, that's a fair point. In terms of the regulator, you're talking about giving it more power, but is there an argument as well, given what Eliza just said there out of the Royal Commission, this dysfunction between state and federal authorities? How do you smooth that out?
Look, God bless our federal system. The Commonwealth cannot decide who goes to hospital. That is a decision made by state health systems and indeed by hospitals. But the Commonwealth did move to establish a set of protocols. As late as last night, I was advised that people who are regarded as clinically needing to go to hospital in Victoria, hundreds of COVID positives have gone to hospital to a point where I think there's a concern about the numbers occupying beds. Either they've gone to acute hospital or if they need to a private hospital. But yes, we do have this division. Commonwealth is responsible for aged care. It's established that response centre to Victoria. I think that's been a good thing. But in future, I think we need to iron these out. Quite apart from COVID, the interrelationship between a federally funded and regulated aged care system and state-run health services is an ongoing problem for the aged care system, quite apart from COVID, but it's been given some sharp focus by COVID decisions.
Given we've known from the outset, Ian, that it's the elderly cohort that's most at risk, the most vulnerable to this virus, how do we drop the ball as a nation in terms of what we're seeing unfold in Victoria right now?
Well, I think that unfortunately, as I said, good many providers have had a case or two, and when you have that level of community transmission, it's difficult to stop it getting into a facility through an asymptomatic staff member. But having got in, what do you do immediately to control it? And even before the Royal Commission, you have examples, for example, from Hammond Care, of examples of how they managed that in an exemplary fashion. So we know that there are providers who can do it well if they follow what they're supposed to be doing. This is pointing to, as the Royal Commission has said, fundamental problems in our aged care system. We have too many providers not up to scratch. We don't have the pressures on them to deliver. Consumers do not have enough control. Very clearly, families don't have enough control. These are long-term issues we've been hammering away at. We also, can I say, need more home care so that we don't have a whole lot of people sitting in residential care when they would prefer to be in home care beds, and we're best part of 100,000 home care packages short.